Good afternoon. I am honored to be joined by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, the Department of Health's Communicable Disease Service Medical Director, another familiar face, Dr. Ed Lifshitz. Great to have you both, as always. To my left, another guy who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan, joined by Director of the Office of Homeland Security and Preparedness, Jared Maples, and others. I just learned via a headline that Shrewsbury Township's Mayor Ed Nolan passed last evening at the age of 73. There was no, I think the article put it well, there was nothing too small in government that Ed didn't care about. So God rest his soul, and our prayers go out to his family. So, welcome, New Jersey, to stage 2 of our restart and recovery. Today we begin the next leg of our journey on our road back. Today, our restaurants may reopen for outdoor dining, and our retail stores may reopen to serve their customers, among other returning services. And restaurants' hours for outdoor dining are not limited by any state order. So there's something out there that implies that restaurants have to close at 8 p.m. There's no restriction, from the state at least. Stay open and enjoy. Further, and to be clear, restaurant hours have never been limited by the state in any way, and even indoor-only establishments may continue to provide takeout each night for as long as their customers are placing orders. And again, there's no restriction in terms of 8 p.m. or any other hour. Additionally, over the past 2 weeks, the Division of Alcoholic Beverage Control has issued 646 liquor license permits for expanded outdoor service. And I thank the staff of the ABC for their very good and hard work. As I've said countless times over the past several weeks, Judy's been amplifying that, as has Pat. We are able to move into stage 2 today because the data we have been tracking, the dropping rate of transmission, the dropping hospital numbers, particularly new hospitalizations, and increasing healthcare system capacity tell us that we are in a safer position to do so. And let's remember, for each stage of this journey back, data determines dates. We are entering this stage with strong public health protocols in place, which, if followed, mean that our residents can have confidence in getting back out and being a part of this recovery. Let's be clear, just opening our restaurants and businesses is one half of this restart equation. If we open too quickly without restoring any consumer confidence, quite simply, there would be no customers. As I have also said, our goal was to get this restart going as quickly as we could, but as safely as we must. There is still a lot we don't know about this virus, but we know two things with absolute certainty. First, that outdoor environments are safer than indoor environments. And secondly, wearing a face covering is safer than not wearing a face covering. This is why our restart has begun by allowing nearly every type of outdoor activity to resume. And it is why, as we gradually restart indoor activities, we are being very strict in requiring face coverings, whether it's in a retail shop or a house of worship, or next week when our personal care businesses may reopen. Indoor environments where it is challenging to wear masks, such as gyms, or where customers are sedentary for long periods of time, such as restaurants, remain the most dangerous in terms of transmission. We will get there, but we will get there based on our data and health metrics. And yes, this also goes for office environments. We know that businesses are eager to have their employees back at their desks, but these indoor environments pose the same problem as any other. For the time being, all employees who can work from home, we want to ask you to remain on the work from home status. If you look around our region, you will see that we are not an outlier. And in fact, we may actually be a step or two ahead of the rest of our neighborhood. Businesses in New York City, in the immediate suburbs, and in the greater Philadelphia area are all working at the same pace as we are, if not, frankly, a little bit behind. Our goal is to not experience the spikes that other states are now seeing because they rushed to open too much too soon. The results are stark. We have lost too many lives in too short a period to not heed the lessons of this virus. What we are doing is working. We have shown the charts, graphs, and maps from many national outlets that show our efforts to reduce the spread and to open in a responsible way are working. We want to get this economic restart going, but our ultimate goal remains to save lives, and that will not change. So as we enter stage 2, let's continue to focus on the big picture. Let's continue to be safe and to practice social distancing and to wear our face coverings. Let's make sure our journey down the road back is smooth and sustained and not jolted by stops and starts because we thought we could go back to the old way of doing things. Now, if I may, let's switch gears a bit. Today, the Department of Health, under Judy's extraordinary leadership, has finalized its guidance for organized sports to resume next Monday, June 22. And since we know outdoor activities are the safest, only outdoor sports may resume at this time. The department is categorizing sports as either low, medium, or high risk based on guidance from the National Federation of State High School Associations. Low-risk sports such as golf and tennis may resume competitions starting next Monday, a week from today, on June 22. Medium-risk sports, baseball, softball, soccer, and outdoor basketball will be limited to non-contact drills and practices only, but barring a significant uptick in COVID-19 as we enter stage 2, we anticipate allowing for the resumption of competition, again, this is for medium-risk sports, on July 6th. And finally, for high-risk sports, such as football, non-contact drills and practices only may similarly resume next Monday, and we hope to allow full practices and competitions to resume starting on July 20. Across the board, all sports will have to abide by a number of health and safety protocols, including screenings for athletes, coaches, and staff, limited equipment sharing, and strong requirements for disinfecting and sanitizing equipment. Activities under the oversight of either the NJSIAA or NCAA must abide by those associations' rules. However, all competitions or tournaments must abide by our limit on outdoor gatherings, which is currently 100 people, but is expected to be at 250 by a week from today and 500 people by July 3rd. Sports is an ingrained part of so many of our communities, in our lives, our families, and we want everyone to be healthy and to be able to get out and play. But even more, we want everyone to be safe. Also, I want to give a big shout out to Senator Paul Sarlo and Coach Assemblyman Benji Wimberly, two dear friends and great leaders, for their work alongside us on this issue. Now, if you permit me, I want to switch gears again to note again the news of President Trump's endorsement for the replacement of the Portal Bridge to move forward. This is a tremendous bit of good news for our state, our commuters, and our building trades. Our administration, alongside our tremendous congressional delegation, has made the replacement of the bulky and obsolete century-old Portal Bridge a top priority. This project is critical to our long-term economic health, not to mention the patience of hundreds of thousands of daily commuters who know all too well the headaches and delays that happen when the bridge fails. But with the commitment from the President that the $800 million federal share can move forward without delay means we can get more shovels in the ground. The Portal Bridge replacement means roughly 15,000 jobs, overwhelmingly high-paying, good-paying union jobs. And it remains a big step in creating the safe, modern, and reliable infrastructure our state and our region need. I cannot overstate the importance, and I am honored to have been able to make the case for the Portal Bridge directly to the President, and I am extremely proud to have gotten this result for our state. It is a huge victory, and I thank the President. Replacing the Portal Bridge is a key piece of the broader Gateway program, and we will not stop until we build the tunnels, build the resiliency, and build out the capacity that our state and that our region needs. Next, again, switching gears. I am proud of the directive released today by Attorney General Gurbir Grewal for all law enforcement agencies across the state to publicly identify officers who have been fired, demoted, or suspended for more than 5 days due to serious disciplinary violations. Until this point, the names of these officers have been kept from the public unless they faced criminal charges. This will no longer be the case. However, the Attorney General's directive isn't just about the future, but it also allows for past cases to finally come to light. And I'm proud of Colonel Callahan's decision to make public the name of all troopers who have faced serious disciplinary actions over the past 2 decades, 20 years, and to do so by 1 month from today, July 15th. This is some 400 cases. Thank you, Colonel. And I urge all law enforcement agencies statewide to follow the Colonel's lead. These cases should not be left as just a passing synopsis in the back of an annual report. They deserve to be seen. They deserve to be out in the open. This is a tremendous step forward for transparency. This is a step forward for law enforcement as well, to help generate greater faith among the communities in which our officers serve that no one will get away with committing serious disciplinary violations. And this builds on the Attorney General's previous work to change the culture of policing across our state, including his directive from 10 days ago, banning the use of chokeholds in all but the most limited situations. Again, I congratulate the Attorney General and Colonel Callahan. And to be sure, New Jersey is leading the way for our nation in bridging the long-standing gaps that have separated law enforcement and our communities for far too long. With these announcements, let's get to the overnight numbers. Yesterday, we received an additional 274 positive test results, and the statewide cumulative total is 167,103. Here are these new cases graphed in relation to the past several weeks. The daily positivity or spot positivity rate for test samples from last Thursday, June 11, was roughly 2.6%. Another good day, Judy, on the spot front. Moving to our long-term care facilities, the trend of newly identified cases of COVID-19 continues its recent downward trend, and we are working as hard as we can to keep it that way, and we are putting equal vigor into stemming the loss of residents to COVID-19 related causes, 5,957 blessed lives lost in our long-term care facilities. In our hospitals, as of last night, the total number of patients being treated for COVID-19 was 1,351, and the number of residents at our field medical stations remained at only 6. This is the breakdown of total hospitalizations across our regions. The number of patients reported in either critical or intensive care was 402, and the number of ventilators in use is 267. We're reporting 74 new hospitalizations statewide yesterday, though we don't have a complete number for Central Jersey, and a total of 107 live residents left our hospitals. And here are yesterday's hospital admittance and discharge numbers charted across regions. These are the trends that are allowing us to move today with great confidence into stage 2. Let's look at this data through a little bit of a different lens as we have recently. The numbers we are seeing in our key hospital metrics, total and new hospitalizations, ICU beds filled, and ventilators in use are all down greatly, not just from our peak 2 months ago, but have continued to decline over the past 2 weeks. And these most recent declines have not only continued practically unabated statewide, but they've also trended across each region of our state. The few bad days that we've had, signified by a red light, have often been followed by a good day with a green light, and the progress we've made on those green light days has been significant. Also, our rate of transmission continues to trend among the very lowest in the country. You can see it's 0.65. That's a very good number. This cannot be overstated. The fewer people who get sick with COVID-19, the more steadily we can travel down the road back. It's just that simple. By independent measures, we are among a literal handful of states that are ready to move ahead because we made sure that science and data were on our side. We are among the leaders nationwide in how far we've decreased the number of residents in our hospitals. You can see it there, number 3 in the country. And we are also among select company in how far we've cut the number of new cases, number 5 in the country. So we are not going to stop being guided by science and data because our responsible approach is working. This moment calls for a Moneyball approach, putting the hard facts to use and following their lead, not making a hasty gut call and hoping that the numbers will simply catch up. And yet we know that we still have work to do, as this chart reminds us of every day. And this is why our approach is and must be responsible and deliberate. We're dropping rapidly among our fellow states in terms of new cases, which is really good and speaks to your continued embrace of social distancing, but we're still top 5 in terms of hospitalizations and fatalities. This is why we are not just going to throw open our doors all at once as other states have done. We've already paid a huge, almost unfathomable price, and our goal remains to save lives, and that starts by keeping people out of the hospital, out of the ICU, and off a ventilator to begin with. Keep this in mind, even with all the positive data we are getting. Today, we're also mourning the loss of another 52 New Jerseyans to COVID-19 related complications. We have now lost a total of 12,676 blessed souls in our New Jersey family. On Saturday, we surpassed the death toll that 4 years of fighting in World War II took on our New Jersey family in just 3 months. Let that sink in. Extraordinary. Let's remember 3 more members of our New Jersey family who we have lost. We begin today by remembering a friend of mine and of many, Newark's Christine Harrell. That's Christine on the right. Christine's mother passed when she was very young, leaving her to be raised mainly by her grandmother, Ida, who passed on her tremendous strength. Christine was educated in the Newark public school system, learning to love the arts, and she learned compassion through the trips to the shore, which her family invited the neighborhood kids whose own families might not be able to provide a day out to join. And it was her commitment to community that led her to volunteer for many political campaigns, including mine, later in life. But the spirit of family was most deeply ingrained in Christine, and despite having held jobs with Aramark and Macy's, it was as the head chef of the family-owned Sweet Potato Grill where she left her biggest mark. Christine was only 65 years old and still had a whole lot more to do. Christine leaves behind her daughters Tia and Shaquana and her son Shakur. Another son, sadly Kyle, predeceased her. She also leaves behind 4 grandchildren and 3 great-grandchildren. Her 2 sisters, one of whom Naomi, with whom I had the great honor of speaking, and a host of nieces and nephews, including a dear personal friend of mine, Dorian Harrell, and his wife Tracy, and close friends, and her life partner, Sammy. They are all in our thoughts and prayers, as is Christine, and may God bless her soul and each and every one of them. Next up, this is Pauline Nawrocki, a lifelong resident of Hoboken. Pauline was locally famous as the owner and chocolatier behind Pauline's Chocolates in Hoboken, where her party planning and decorating talents and exceptional chocolate creations took center stage. Many customers knew her by name, but the entire mile square city knew the chocolate lady. She was generous, often giving away her chocolates to families she knew needed a lift or who couldn't afford a gift, and always gave of her time to plan the perfect event, whether for 100 people or just a family birthday. And Pauline also organized monthly casino trips for Hoboken seniors to give them the opportunity to get away for a day of entertainment. Pauline leaves behind her daughter Tracy, with whom I had the great honor of speaking yesterday, her son Jan and their spouses, along with 3 beloved grandchildren, Benny, Nicole, and Matthew. She also leaves behind her sisters, Amelia, Antoinette, Joanne, Nancy, and Mary, and loving nieces and nephews. I spoke, as I said, to Tracy yesterday, who, like many families, was very frustrated by how life ended for Pauline and the inability for folks to be with each other and not get the communication that in so many cases they would have wanted. I know has taken an extra toll on so many out there. I did ask Tracy, give me a couple of words or concepts or phrases that would describe your mom. And generous, as I mentioned, funny, and that story about taken care of folks who came into the shop who didn't have enough money to buy the chocolate, but essentially said, you know what, you all take it, you need a lift. Pauline was only 68 years old. She was a Hoboken original, and she will be fondly remembered by all and missed dearly by her loved ones. Finally, today we remember Dr. Nagy Abraham of Edison. There's a $1 million smile. He was born in Cairo, Egypt, and pursued his dream of a degree in medicine, becoming an internal medicine doctor with a specialty in infectious disease. Nagy, his wife Laurice, with whom I had the great honor of speaking yesterday, and their family arrived in the United States in 2005, where he joined a clinical laboratory science program and obtained his board certification from the American Society for Clinical Pathology. For the past 11 years, he worked in the lab and hematology department as a medical technologist for University Hospital in Newark, and maintained affiliations with both Overlook Medical Center and Englewood Hospital, one of the early healthcare centers to treat patients suffering from COVID-19. Nagy was known and respected by his colleagues for his intelligence and organizational skills and his vivid and lively personality. They also knew him for his compassion, the hallmark of his devout Orthodox Christian faith. Nagy leaves behind Laurice and their 2 children, their son Peter and daughter Marina. He also leaves behind his family at Healthcare Professionals and Allied Employees Local 5094. He was just 66 years old. We thank Nagy for his service to our state and people as one of our frontline healthcare heroes. May God bless him, and may God also grant peace to those left behind. As I noted, we have now lost more New Jerseyans to COVID-19 than we did across all of World War II. We have lost New Jerseyans in every county, just as we lost soldiers, sailors, Marines, and airmen from every county. I was on with Joe Griffey's and Bill Davenport on Saturday. I was honored to be on their program, and I alluded kind of generally to this. It's a moment, I think, that we have to stand back and acknowledge the solemnity of this moment, but also acknowledge those who served our country and our state representing our country in World War II who lost their lives. So as we pass this solemn milestone, let us also pause to remember our hallowed World War II dead who gave their full measure in the fight against fascism and hate and died somewhere between 75 and 80 years ago on the battlefield as young adults. And with that, I'd like to recall the name of just one of these dead from each of our counties. Marine Corps Private First Class Theodore V. Chowanaki, Atlantic County. Army Staff Sergeant Robert E. Hickson of Bergen County. Marine Corps Reserve Private Norbert Rowan, Burlington County. Navy Reserves Chief Shipfitter Henry Patrick Scully of Camden County. Navy Aviation Chief Ordnance Man Lyle Joseph Schulten of Cape May County. Army Private Claude H. Willis of Cumberland County. Navy Mess Attendant First Class Marion Davis, Essex County. U.S. Marine Corps Private Daniel Francis Corella, Hudson County. Navy Reserve Water Tender Second Class William Joseph Spencer, Gloucester County. Navy Reserve Seaman First Class Adam Anthony Detieri, Hunterdon County. Marine Private Miroslav Kamela, Mercer County. Army Private First Class Julius V. Gasgaber, Middlesex County. Navy Reserve Second Lieutenant Francis Edgar Class, Monmouth County. U.S. Navy Reserve's Electrician's Mate Second Class Charles Copeland of Morris County. Navy Reserve's Aviation Radio Man Third Class Francisco Alesso of Passaic County. Navy Coxswain Thomas Tilton Wardell, Ocean County. Army Private Carmen B. Burkendi, Salem County. Army Corporal George W. Fowler, Somerset County. Army Sergeant David J. Silverman, Sussex County. Army Sergeant Sidney V. Craig of Union County. And Army Lieutenant John Miller of Warren County. For the 12,565 New Jerseyans who gave their lives in that conflict, for all of our veterans whose lives have been lost, and for the 12,676 who have now lost their lives to COVID-19. I ask that we observe a moment of silence. Thank you. Let none of their names or memories ever be lost to time. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. As the Governor reviewed, the Department is releasing standards for sports activities today. These standards will guide organizations that oversee sporting activities to protect health and safety of players, staff, and their families as operations resume. In addition to what the Governor outlined, I want to share some additional information. As part of safety measures, organizers must create a program preparation plan that outlines policies for resumption of activities. As part of that plan, program leaders should identify adult staff members or volunteers to help remind coaches, players, and attendees about social or physical distancing measures. The use of signs, tape, and physical barriers can be used to assist with guiding social distancing requirements. Staff, parents, and visitors are required to wear cloth face coverings at practices and games. Athletes are encouraged to wear masks during downtime, but should not wear masks during periods of physical activity. Any equipment sharing must be limited. All shared objects must be cleaned and sanitized at the end of each practice, game, and between uses. Athletes are encouraged to bring their own water bottles and equipment to practice. Athletes and staff must be screened through a temperature check and a health questionnaire prior to practices and games. If an individual has symptoms, they obviously cannot participate in activities. Program leaders are required to divide larger teams into smaller groups and stagger practices at different times or across different days. Any non-essential visitors, spectators, staff, volunteers, vendors, and other attendees should be limited. Each facility that will be used for practices should post signage in highly visible locations with reminders regarding social distancing protocols, face covering requirements, and good hygiene practices. Hand sanitizer, disinfecting wipes, soap and water, or other sanitizing materials should be readily available at entrances, at exits, benches, dugouts, and any other area prone to gathering or high traffic. There should also be routine and frequent disinfecting and sanitizing at the facility, particularly of high-touch areas. Physical activity is vital for our overall health. These measures will help to keep participants safe while engaging in their favorite outdoor sports. Moving on to the daily report, as the Governor shared, our hospitals are reporting 1,351 hospitalizations with 402 individuals in critical care, and 66% of those critical care patients are on ventilators. That is the lowest percentage of patients on ventilators to date. There are no new cases of multisystem inflammatory syndrome in children since Friday. The total remains at 40 cases. The children affected have either tested positive for active COVID-19 infection or had antibody tests that were positive, indicating exposure to the virus. In New Jersey, there are no deaths reported at this time. The ages of the children range from 1 to 18. 3 children are currently hospitalized. The breakdown of race and ethnicity is white 21%, black 32%, Hispanic 35%, Asian 9%, and other 3%. The Governor reviewed the new cases and deaths reported today. Sadly, today's report of deaths includes the loss of a young child who had an underlying medical condition. In order to protect the privacy of the child and the family, the Department of Health will not be releasing further details. In terms of deaths, the breakdown by race and ethnicity is as follows: white 53.9%, black 18.5%, Hispanic 20.3%, Asian 5.7%, other 1.7%. The state veterans' homes numbers remain unchanged, as does our state psychiatric hospitals numbers. The daily percent positivity as of June 11th overall in New Jersey is 2.63. Northern New Jersey is 2.03, Central 2.24. The southern part of the state is at 5.25. That concludes my daily statistical report. Please continue to take precautions to limit the spread of COVID-19. We all have a role to play in protecting ourselves and others. Stay connected, stay safe, stay healthy, and get tested. Thank you.
Judy, thank you for that and for all. You said two different things, and I want to make sure that folks heard, I guess, through transitive properties, the connection. So we've got no new cases of multi-system inflammatory syndrome. It sits at 40, but also no fatalities. Separately, you said the awful loss of life of a young person who had underlying comorbidity. By definition, therefore, not the inflammatory, multi-system inflammatory syndrome.
Right.
So that hopefully addresses a question that we might get. Thank you for everything. Pat, obviously a lot going on over the weekend. Would love to get your sense of things and any other matters you have. And again,
Sure.
Thank you.
Thank you, Governor. Good afternoon. Although a busy weekend with regard to protests, I think we had upwards of 50 that we had each one of those end peacefully. Beaches and parks, no reported issues. We did have an EO violation up in Hampton Borough in Hunterdon County, where two subjects were cited for having a house party with more than 100 people. They were cited for the EO violation as well as serving alcohol to minors. And I just take a moment, I know that outside dining is huge, to commend those municipalities that have been creative in using sidewalks and parking lots. The overwhelming, I'd say just about vast majority, just being creative in order to make sure that they're doing it safe. They're working with law enforcement and their public works, and I thought it was worth noting those that were, should be commended, Governor. Thank you.
Thank you, Pat. It is a good point to underscore. We'll start over here, Matt. It's a good point to underscore that there's a very small minority of folks who choose to use a bullhorn or go the other way. Overwhelmingly, folks and communities are the Main Street is being transformed in so many communities. I know near us, it's not going to be today. I think they're going to do it Thursday through Sunday. Red Bank is shutting down Broad Street and Monmouth Streets and allowing, the restaurants to be able to put their tables outside, expand. I suspect a banner year for tent businesses, but I mean that's the spirit, and the spirit has been overwhelming, absolutely overwhelming. So hats off. That's a great point to have made. So thank you. Before we move on, Dan is with us. Unless we hear otherwise tomorrow, we're together at 1 o'clock, right? And we have a White House VTC later today, which Judy and Pat and I will be on, I believe at 4 p.m. And tomorrow, as I say, we'll be with you at 1 o'clock unless you hear otherwise. So thank you. Elise, good afternoon.
Good afternoon. Could you explain the significance behind publishing the names of officers who have committed disciplinary violations? What is the public supposed to do with this information, particularly if the officer is still employed? And what about officers who have been involved in cases of excessive force? Are details of those instances currently available? Thank you.
Thank you, Elise. I'm just going to make a very brief comment and maybe ask Pat to weigh in as he is a leader in uniform. I think I think this is good for everybody. In particular, with an emphasis on building, even deepening and building further trust. In the sense of, in the absence of information in life, this is not just in this case, in the absence of information in life, you assume the worst. With information, I think you've got a much clearer sense of the reality, and I think that's good for everybody. But with that, I don't wear a uniform. Pat is honored to wear one, and we're honored to have him with us every day.
Thanks,
Please.
Gov. Well, the state police already publishes summary information with regards to major discipline, a summary of those. The Attorney General's announcement today changed that internal affairs directive to really just include the name now, Elise. And in our several weeks of discussions in public forums, we talk about embracing the scrutiny, embracing transparency. It's also important to note that the acts of a few should not tarnish the entire profession across the state or nation, and we'll ultimately let the public decide for themselves on the nature of these allegations. Excessive force, if substantiated and led to a major discipline as far as a suspension goes, that will also be included. And I do also think it's important to note that beyond transparency, there are several members of the state police that have discipline, that have bounced back and have been that resiliency that we so often talk about, that have gotten their lives and their careers and serve as phenomenal examples. And it's important to note that because some decisions that I know regret have now led to life-changing and career-changing events, and they're still able to serve the citizens of New Jersey with tremendous pride and dedication.
Thank you, Elise. Matt, good afternoon. Give us 1 sec.
Commissioner, in the past, you have released the ages of young people who have died. Would you release the age, at least in this case? Governor, what specific numbers does New Jersey need to see to set a date for Stage 3? Does that seem like it's weeks or months away? On the Portal Bridge, because the Federal Transit Administration changed its rating on the Portal Bridge, and all that was needed all that was needed was a project engineering agreement to be finished and for the FTA to release the $800 million. So how does the president's endorsement affect either step? Or does it just mean he won't stand in the way? And finally, Governor, we've been asking you to comment on the corrections officer who took part in that mock killing of George Floyd and whether he should be fired, and whether you would commit to signing or even lobbying for transparency legislation when it comes to police oversight. So I'm curious why you would do things like take part in Black Lives Matter protest, but stop short of taking a larger stand on either of these matters or lobbying for stricter reforms like Governor Cuomo signed in New York.
Okay. Judy, the age. Did you disclose the age? I can't recall.
I didn't. We usually try to keep that quiet, at least for a while, until the obituary gets published and the family has some privacy. But it was a very young individual.
Yep. And if we can, at some point we will, but other than that, we've wanted to keep privacy here, including the nature of the underlying health issues, which it's going to be the ones that matter the most, I think, and Judy should come in here because at the end of the day, my opinion matters, but I don't do anything without the holy water coming at me from the folks to my right. It's going to be the here and now data that we show you literally every day, but in particular, spot positivity, rate of transmission, new hospitalizations. The other stuff matters as well, but those are the three I think that matter the most, Judy and Ed. And again, there are other data matter for other reasons, but those are the three that matter the most. And I think this is a question of weeks and not months. I hope we'll be giving some more guidance on some steps even as much as later this week. Listen, we had made a significant amount of progress on the Portal North Bridge, but we still need a full funding agreement, and the president's green light on Friday allows us to proceed with that. This is an $800+ million federal slug, so that is the big piece of this that can now proceed. This is, as they say in the trade, shovel ready. And this is, I think I mentioned this in my remarks, this is incredibly significant at many levels, including 15,000 plus overwhelmingly union jobs. So it's a big step forward. I'll tell you, I'm not sure. I think as a personnel matter, there's a process in place that we have to respect that has to play out. I've got nothing new to report on the corrections officer. I think the Attorney General's step today, along with his, I think, almost overlooked chokehold directive of 10 days ago, Pat. These are huge steps forward. And so I would say, with all due respect to the progress that you've seen in New York, we've made an enormous, we're taking big steps here as well. We also had a leadership meeting. Matt can weigh in here and discuss with both the Senate President and the Speaker a whole series of legislation that is coming sooner than later. And I'll leave it at that because we don't get into commenting on a specific piece, but there's going to be an enormous amount of action being taken here. Matt, do you want to add anything to that?
Yeah, I would just to underscore what the governor just said. We've had very productive meetings on with the legislature, both on the Sentencing and Disposition Review Commission bills that were discussed back last fall, as well as the dozen or so bills that the speaker is moving through committee today. I would also just note one difference that's unique to New Jersey is the constitutional structure and the ability for the Attorney General to issue a law enforcement directive like he did today, which is not true in other states. So he's able to change the behavior of law enforcement officers and agencies across the state through a directive like the one he issued today, which is significant and in many, if not most states, would require legislation.
Thank you for that. Thanks, Matt. Sir, do you have anything? You good? Come across here, Matt. Watch the hamstring. Ann?
Governor, do you think every town should have a civilian review board to investigate conduct of local police? And do you support the removal of Christopher Columbus statues in New Jersey? When you introduced your Road Back plan in late April, you said the recovery process would be an opportunity to address issues that drive racial disparities in health. With this process now underway, can you provide concrete examples of how the administration is addressing these racial gaps? Thank you.
Hold on one sec. Let me start with the last one. There's a whole lot going on through a whole variety of lenses, but I think the specific point I assume you're talking about is healthcare specifically. So Judy has talked about this every day, and I was going to actually mention and forgot to, that let's not forget the disparities. And so we've spent, since the moment we got into office, and we just are continuing on. I think the key now is to accelerate the pace to address what, Judy, you talk about all the time, social determinants of health, about inequities in the access to health care, which we have been committed to from day one. But again, I think this is an accelerating. My wife's work with Judy and others on infant and maternal mortality is an example of a program with very specifics that has come a long way and continues to be a work in progress. We think about workplace issues all the time, and the disproportionate representation of Black and brown communities in what we have deemed to be essential services and essential positions at the front lines of this pandemic. And how do we get more equity in whether it's workforce development, educational opportunity, or access? So it's a whole range, and I would say it's overwhelmingly a work in progress. I wish I had a simple magic wand, magic bullet answer. Listen, I've said this publicly. I don't know about every town, but I think the Civilian Review Board has been a big success, personal opinion, in Newark. And it's got to be, as I've mentioned several times over the past couple of weeks, it's got to be a consideration on the table as we think about that mosaic of what is the right, what does society on its best day look like, an equitable, fair society that values every human life equally. I don't know that I've spent a whole lot of time thinking about the Christopher Columbus statues, so I'm not sure I'm going to make news necessarily in answering it, but yeah, I'm less focused on that, frankly, right now than I am on what we need to do in the here and now, but I do think symbols matter. There was a discussion we had, among other things, at dinner with the president on Friday night, was the whole moment in time we're in right now, the need to be together, to come together. the Confederate statues, the naming of the military bases. I think if symbols run counter to a society that works for everybody equally, then we have to take that consideration very seriously. So thank you. Sir, are you good? You just got the camera today. No questions. Ashley, how are you?
Good, how are you?
Nice to see you.
So some quick clarification on the new Attorney General order. Does the order require agencies to publish a list of past violations or simply allow them to do so if they choose? Governor, I'm not sure we totally understand Trump's portal bridge tweet, so I apologize for asking a little bit more on this, but it sounds like the president is giving $800 million for the project. Can you clarify if that's the case and what the next step is? If it's a $1.8 billion project, where does the rest of the money come from? A question from Charlie Style. Given that you
Style.
Yes,
Hold
you'll
on,
be able to
hold
tell
on,
by the
hold on,
wording. Given that you have shown solidarity with the protests over systemic racism, why did you feel compelled to dine with a president whose rhetoric, tweets, and his vow to dominate cities with military force have only inflamed racial tensions? And since you did go, did you seize the opportunity to urge his public support for reforms, such as Cory Booker's bill banning chokeholds, et cetera? And then, is the Labor Department's new call center up and running? And if so, how can workers get in contact with live Labor Department workers to help them with their cases? Is there a phone number you can share? And final one. The Department of Health published data on cases and deaths by zip code, but did not include zip codes that have 20,000 residents or less. Can you explain how the Department of Health picked that high threshold, especially since it eliminates about 1/3 of the residents that live in New Jersey? How does giving a range of the number of people who contracted or died from COVID in a town of 10,000 residents, say, give away private information when it does give us good information on, for instance, if there are a lot of cases in majority-minority communities? Thank you.
Thank you. To say that your questions span a variety of topics would be the understatement of the day. Matt, past versus mandating versus encouraging. Pat,
It does. For the state police, we're looking at the past 20 years of substantiated major discipline.
And beyond that, there's a strong encouragement, right? Is that a good word to use? Encouraging. The president's, the discussion both in substance as well as the message that he put out is that it's about a $1.8 billion project. The feds, there are a couple of different numbers that get put out there, but I'm a little bit on the higher side. When you add everything together, it's more like 923 million is the number that I've used as a walking around number. The other half of it is New Jersey and Amtrak. And his tweet, and more importantly, the substance of the discussion is this will now allow us to go to the full funding agreement to come up with the monies that I just mentioned. Here is my answer for Charlie. It's quite clear that there are strong, this is a moment in time, perhaps unlike any other in our country, and it ought to be quite clear that there are a whole range of issues that the president and I would be in a different place on. But I want to reiterate what I just said a minute ago. We did discuss this moment in time, the need for us to come together as a nation, Confederate statues, Army bases with the names of Confederate generals. That we in fact did discuss that. I don't get the luxury, as I've said before, of waking up and choosing which president on that day that I can deal with which administration. He is the president of the United States. On something like Portal, on something like COVID-19, on our economic recovery. There's one federal government, there's one administration. They play an existential role that no other player can play, and we need to be able to find that common ground with a passion just as intense as the passion to stand our ground and not pull punches on areas where we're not going to see things the same way. I don't have an answer for you on the Labor Department call center, but can we come back to you on that? Dan, will you help me out? Thank you. Judy, any color on the the level of detail in the cutoff at 20,000.
Yeah, it's my understanding that's the guideline that the privacy officer at the Department of Health has followed for quite some time. But it's worth looking at for all the reasons that you've brought up, and we'll commit to doing that.
I think your points are well taken. I just don't know let's come back to you on that if we can. Thank you. Sir.
Good afternoon, everybody. Governor, two quick questions. I know that today Rutgers started bringing back their players, and based on your announcement today about sports, do you expect to be talking to Coach Schiano anytime soon? And the other question is, I know you're a huge proponent of the LGBT community. Just your thoughts on the landmark ruling today by the Supreme Court allowing workers not to discriminate against transgender and gay Americans.
Yeah. I spoke, Matt and I spoke last week, early week, I believe, maybe 2 weeks ago, with Athletic Director Pat Hobbs, Coach Vivian Stringer, Coach Steve Pikel, and also Coach Greg Schiano about the general direction that we anticipated things would be headed. Judy's guidance has come in since then, but we sort of previewed that with them, and we're in pretty regular contact with them. I've not had a chance to review the decision, but the notion that the LGBTQ plus community can stand tall and not be discriminated against is a big deal. It is a big, big deal. And I'm proud of, in our state, the fact that we've been from moment one in that space, and we will continue to be, and please God, our nation will as well. So thank you for asking it. I think that's it. I want to, as I mask up and get ready to move, looking forward to eating outdoors tonight, Pat, at a restaurant. First restaurant experience in many, many months. I want to mask up and just say a couple of quick things as we go. Judy and Ed, thank you, as always, for everything, for being here, and for your leadership, as good as it gets. Pat, likewise to you. Jared, Matt, and Dan team, thank you. Want to end by thanking everybody out there for continued great, overwhelming. There are a couple of folks out there get a big megaphone or trying to make a point. The fact of the matter is it's a vast minority, overwhelmingly by the millions, or in the cases of restaurants or businesses, by the thousands, if not tens of thousands, folks have done the right thing. Pat mentioned the creativity, which has been really impressive. And I think there's going to be a sort of almost a festive feel to the state beginning today. So thank you for all of that. Continue to cover your face, keep social distance, wash hands with soap and water. This could come back, please God it doesn't, but keep up the great work. Keep up the great peaceful protesting. Where our state has been almost unlike any other. Enjoy your outdoor dining. Please over-tip. These folks will never be able to make up the meals that were lost. Enjoy your retail experience. Back to daycare. The first steps in the Motor Vehicle Commission getting back up and running. Common sense for the common good. Everybody coming together. It's an overwhelming feel in the state right now. Keep it up, folks. God bless you all. Thank you all. We'll see you tomorrow.